When should you start working with a pelvic floor PT after birth? Hey y'all, I'm Dr. Mai Hughes, pelvic floor physical therapist and mom of two. And in full transparency, I recommend working with a pelvic floor physical therapist, whether you've had a cesarean or vaginal delivery, as soon as you can after giving birth. There's so much that can be done to promote your physical healing before reaching your 6-week clearance, such as breath work, upper back mobility, lower body mobility, and reconnecting with your deep core musculature to help make everyday activities easier, such as going from sitting to standing, or lifting the car seat, or lifting your baby. Now, not every pelvic floor physical therapist is going to feel comfortable working with you prior to receiving your 6-week clearance note from your OB or your midwife, and that could be due to the therapist's personal comfort level or due to insurance restrictions, unfortunately. So if this is the case and that is your physical therapist, then I do recommend waiting until you receive your 6-week clearance from your OB or your midwife to begin pelvic floor therapy. It's also important to note that your pelvic floor physical therapist is not going to perform an internal exam before you are 6 weeks, sometimes even 8 weeks, to ensure that you have achieved physical healing and that you feel personally comfortable with the internal exam. So you're just going to perform an external exam and work on the full body healing of your body and mobility and strengthening prior to doing your internal exam. I am 4.5 months postpartum, and I personally scheduled a pelvic floor PT appointment at 2 weeks postpartum. We did not do an internal exam. We scheduled another appointment at 6 weeks where we did perform an internal exam, and that is exactly how I recommend going about postpartum pelvic floor PT, whether you've had a vaginal or cesarean delivery. If you found this information helpful, share it with a friend and make sure you are following along for more pelvic floor, pregnancy, and postpartum education.